My name's Eileen Goldstein, and I'm here today to introduce you to the Da Vinci robotic system and see if it could be helpful for you in gynecologic surgery. The Da Vinci system was first created for the military, really, to protect the physicians and allow them to be in a more remote location while they may need to be helping soldiers that were hurt in combat. And it's translated into mainstream surgery now. And here at Virginia Beach OBGYN, we do a lot of benign gynecology procedures, and now we've been able to incorporate the Da Vinci robotic system into our experience and can now offer it to our patients. So after having a talk with your gynecologist and determining that Da Vinci surgery is right for you, you'll come to the operating room where the anesthesiologist will place you to sleep. And once you're asleep, what we'll do is we'll place these small incisions in your abdomen, the largest of which is about the size of my thumb, and the smallest of which is about the size of my pinky. And most patients have between 3 and 5 incisions on their abdomen. Through those incisions, we're able to put these sleeves that we call trocars. The trocars allow us to take these instruments and place them into your abdomen and pelvis and really complete the procedure. Once all the trocars are in place, we take what we call the robotic patient cart, which looks like a robot, and we bring it over to the side of the bed. And we attach all the robot arms to those trocars. And then we can use instruments and pass them into the arms, through the sleeves, and into your abdomen and pelvis so that we can safely complete the procedure for you. Once we're done with that part, the surgeon actually goes over and sits down at what we call the surgeon console. And then we use a combination of foot pedals and hand controls to actually control the instruments. The hand controls move around just like your hands and your wrists do. They articulate, and that allows us to do surgery for women who previously really weren't candidates for minimally invasive surgery. For example, those with really complex anatomy or multiple previous surgeries or very high body mass index. This is an example of one of the robotic instruments that we use, and we place the instrument into the robotic arm and then through the trocar that we've placed into your abdomen, and then we use the tip of this instrument to perform the surgery. And as you can see, the tip of the instrument is about the size of a penny, so it's much smaller than our hands and enables us to be so much more precise with our movements.
Why am I so excited about the Da Vinci robot? The 3D optics allow us to see the anatomy so much better so that we are able to operate with greater precision. The articulating instruments can move and bend in ways similar to how our hands would operate, but they're able to work in much smaller spaces. We know from our medical literature that open hysterectomies have about a 12% complication rate, whereas the Da Vinci has about a 2% overall complication rate. A recent cost analysis from Harvard published in the Journal of OBGYN showed that the cost of a Da Vinci hysterectomy was actually less when compared to all other forms of hysterectomy. What this means is that more patients can have minimally invasive surgery at reduced healthcare costs.
Most of our patients go home the same day, and some stay 24 hours or so just to be observed. A lot of our patients describe very little post-op pain and a really short recovery phase. Thank you so much for taking the time to watch, and let us know if there's anything we can do to help you if you think you need gynecologic surgery with the Da Vinci system. We're really excited here at Virginia Beach OBGYN to be able to incorporate this into our practice and offer it to our patients.